What's up, ladies and gentlemen? Welcome back to Neurosketch with Dr. Kenny. But if this is the first time you've seen this channel, don't forget to subscribe. Today we're going to have a quick recap on the typical features, the features of typical thoracic vertebra. I'm going to take this one as an example, and we said the body of the thoracic vertebra is expected, number one, to be heart-shaped, as we can all see, heart-shaped. But the body is also expected to have four costal demifacets, half facets, four. Two on this side and two on the other side. That's the body of the thoracic vertebra. But what about the articulating processes or articular facets? We said superior articular facet expected to point a little bit posterolaterally, but the inferior articular facets, let me show you here. The inferior articular facets are pointing a little bit inferior and a little bit to the medial side, but the transverse processes here are expected to have two articulating facets. Each transverse process of the typical thoracic vertebra is expected to have articulating surface or articular facet, and is called the transverse costal facet. What about the spinous process? We said the spinous process of typical thoracic vertebra is expected to point in inferior posteriorly, and the tip of the spinous process is expected to be found at the level of the thoracic vertebra below. For example, if this is T4, we said the tip of T4 is expected to be found at the level of the spinous process, the level of the vertebral body of T5. Yeah, this is it about the typical features of the vertebra.